Resistance of a number of gram-positive organisms to many antibacterial drugs has become a huge barrier to treating infections in recent years. In particular, organisms such as methicillin-resistant Staph aureus, MRSA, and vancomycin-resistant Enterococcus, VRE, are becoming more prevalent and more difficult to treat. Several newer drugs have been developed recently to specifically target these resistant gram-positive strains. Linezolid and new tedizolid are ribosomal protein inhibitors. They bind to the ribosome and prevent the initiation of protein synthesis. The pharmacokinetics of tedizolid allow for once-daily dosing instead of twice-daily required for linezolid. The principal uses for these agents is for infections suspected or proven to be due to resistant gram-positive pathogens such as MRSA and VRE. This may include skin and soft tissue infections and community or hospital-acquired pneumonia with or without bacteremia. Because of bone marrow suppression and thrombocytopenia, peripheral and optic neuropathy, and lactic acidosis, these agents are generally for short-term use. Fewer low platelet counts and gastrointestinal side effects have been reported with tedizolid than with linezolid, which aligns well with antimicrobial stewardship principles. Linezolid therapy should ordinarily be prescribed in a hospital setting after examination by an infectious disease specialist. Part of the reason for an ID consultation is related to the potential toxicity of the compound. Linezolid therapy remains relatively expensive. Inappropriate use may induce the development of high-level linezolid resistance through mutations or acquisition of a resistance plasmid. In general, linezolid should be reserved for the treatment of MRSA infections as an alternative to glycopeptides. Daptomycin is a large molecule that can accumulate in the cell membranes of susceptible gram-positive organisms, leading the membranes to become porous or leaky and osmotically unstable, and eventually leading to cell death. Daptomycin is a parenteral agent useful for staphylococcal bacteremia of unknown source, especially MRSA, and for right-sided infective endocarditis. Can also be used for complicated skin and soft tissue infections, especially those resulting from suspected resistant gram-positive bacteria, such as MRSA. It should not be used for pneumonia due to gram-positive organisms because it is inactivated by lung surfactant. Skeletal muscle toxicity and immune thrombocytopenia are the most common side effects associated with daptomycin. Patients taking this drug should undergo weekly monitoring of their creatine phosphokinase levels. The drug should be discontinued if the CPK levels rise more than tenfold above normal, or if a patient shows symptoms of myopathy and has a CPK level over 1,000 international units per liter. In patients with MRSA infections demonstrating reduced susceptibility to vancomycin, treatment with vancomycin has been associated with poor outcomes. An early switch to daptomycin may improve outcomes without increasing hospital costs in these patients.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.